GuideLiner catheters are intended to be used in conjunction with guide catheters to access discrete regions of the coronary and/or peripheral vasculature and to facilitate placement of interventional devices. The GuideLiner catheters are contraindicated in vessels less than 2.5 millimeters in diameter and in vessels in the neurovascular or the venous system. Remove the GuideLiner catheter from the dispenser coil and thoroughly flush the lumen of the GuideLiner catheter from the distal tip with sterile heparinized saline solution. Secure the previously inserted guide wire and backload the distal tip of the GuideLiner catheter onto the guide wire and advance until the catheter is just proximal to the hemostasis valve. Open the hemostasis valve and advance the GuideLiner catheter through the hemostasis valve and into the guide catheter. Under fluoroscopy, advance the GuideLiner catheter beyond the distal tip of the guide catheter and into the desired location. Using fluoroscopy, confirm the desired position of the GuideLiner catheter in the vessel. Warning: never advance the GuideLiner catheter into a vessel with an effective diameter less than 2.5 millimeters. Vessel injury, ischemia, and/or occlusion may result. If pressure in a vessel dampens after inserting the GuideLiner catheter, withdraw the catheter until the pressure returns to normal. If performing an interventional procedure, backload the interventional device over the existing guide wire and advance the device through the guide catheter and GuideLiner catheter into the desired vascular space. Tighten the Y-adapter hemostasis valve securely on the proximal shaft of the GuideLiner to prevent back bleeding. After completing the procedure, remove the GuideLiner catheter prior to removing the guide catheter from the vessel. As a rapid exchange device, there is potential for wire wrap to occur when using the GuideLiner catheter. Wire wrap can interfere with the GuideLiner's ability to deliver interventional devices. A towel can be used to minimize the potential for wire wrap when using the GuideLiner catheter. To employ this technique, backload the GuideLiner over an in-place 14 thousandths guide wire and advance the catheter to its distal target. Once the GuideLiner has reached its distal target, move the push rod to the side and secure under a towel. By moving and securing the push rod away from the hemostasis valve, the potential for wire wrap in the GuideLiner half pipe and distal sections is minimized.